Hello, everyone. My name is Kiran Martin. I'm an Indian pediatrician and the founder and director of a nonprofit called Asha. Asha was established by me in the year 1988 and works in the slums of Delhi, serving over 700,000 slum residents in the city. For more information on Asha, please go to Asha's website, www.asha-india.org. There is also additional information on me and on Asha in the description box below. Today, I would like to share my thoughts on compassion in healthcare. I have often spoken of compassion in general as it is a key Asha value. Today's focus is on how healthcare with compassion can completely revolutionize the impact of healthcare on patients. The English noun compassion means to suffer with and comes from the Latin words cum, meaning with, and passio, meaning suffer. Scientists define compassion as the emotional capacity to understand another's pain or suffering and then take action to alleviate it. It is different from empathy, in that empathy is the feeling and understanding component, but compassion also involves taking action. Thousands of patients from the slums have been receiving healthcare at the Asha clinics over the years. The poverty that they live in is already causing them a great deal of suffering. When they come to the clinic for a physical ailment, they are often miserable and anxious and feel that nobody really cares for them. That is their experience at home and in their communities. Not only do they want relief from their illness, but they are desperate for someone to show them compassion. Research has demonstrated that there is a compassion crisis in healthcare settings worldwide. A Harvard study showed that 50% of patients in the US believe that healthcare providers are not compassionate. It also shows that compassion comprises less than 1% of all communications to patients. In another study at Harvard, research demonstrates that nearly 2/3 of our youth feel that their parents do not value caring for others as much as they value achievements and accolades. In a recent Pew Research Center study, it was found that 1/3 of all Americans do not even consider compassion for others to be among their core values. It's not just the US that is experiencing a compassion crisis. A public inquiry into the National Health Service in the UK found a widespread and striking lack of compassion from healthcare providers. This is therefore a worldwide phenomenon. Through the following examples, I would like to demonstrate that compassionate care belongs in the domain of evidence-based medicine. Of course, compassion is not a substitute for quality clinical care. But when compassion is used in conjunction with excellent clinical care, it can be incredibly powerful. Clinical excellence and compassion, when used together, deliver the best outcomes. A study published in the New England Journal of Medicine showed that when anesthesiologists were able to build a bond with a patient ahead of surgery, where they showed they cared about them, the patient needed lower amounts of sedatives. When they were wheeled into the operating room, they were more peaceful and calm. Therefore, it was not only about anesthetic agents, it was also about the anesthesiologist who became a part of the therapy. What is the science behind compassion? Compassion acts in a powerful way on our autonomic nervous system. This system has two pathways, the sympathetic and the parasympathetic system. When the sympathetic system is activated, the fight or flight response to threat, danger, and stress in general kicks in. However, sustained activation of the sympathetic nervous system due to prolonged stress and anxiety creates a spike in the levels of circulating hormones, cortisol and adrenaline. This can cause all kinds of physical symptoms that are not conducive to healing. On the other hand, activation of the parasympathetic nervous system produces a feeling of peacefulness and calm. It lowers our stress and quells our fears. It is also called the relaxation response. It is this response that is activated by the exercise of compassion. Compassion harnesses the power of the parasympathetic nervous system, and this can change the physiology of the receiver of compassion. It lowers blood pressure, lowers respiratory rate and heart rate, and buffers the patient's cardiovascular responses. Along with activation of the parasympathetic nervous system, compassionate touch raises the levels of another circulating hormone called oxytocin. This molecule causes increases in feelings of bonding and affiliation. It creates trust and is therefore called the trust hormone. Patients do want to trust their doctors, but trust is not automatic. It has to be built through the practice of compassion. When the physician is trusted, the patient has a much better patient experience. There are numerous other wonderful ways in which the exercise of compassion affects patients, bringing them much relief. For example, compassion reduces the perception of pain, reduces headache, reduces pain due to irritable bowel syndrome, promotes healing from trauma, improves quality of life as well as survival in palliative care, helps wounds heal faster, and even improves the symptoms of common cold. You can read about research that demonstrates these findings in a book called Compassionomics, written by Stephen Tresiak and Anthony Mazzarelli. It's a wonderful book and highly recommended. Research conducted by Thomas Jefferson University in Philadelphia demonstrates that in patients with type 2 diabetes, the odds of optimal blood sugar control were 80% higher with high compassion physicians. This is because the activation of the parasympathetic nervous system positively affects endocrine function. So, how do we in Asha practice compassion in our healthcare settings? Number one, we sit and speak with our patients rather than stand. Number two, we try and listen to our patients first as much as possible and make eye contact while listening as well as while talking. Number three, we try and stay calm ourselves and show kindness and empathetic concern for our patients. One of the best ways of showing empathy is to validate the patient's feelings by saying things like, I understand how you are feeling, or I can imagine how difficult it must be. Number four, we say words of reassurance like, I am with you in this. Don't worry, you are not alone. Number five, we make every effort to understand the personal history of the patient. We are fortunate that we have strong connections with the families and communities. Our team members, community health workers, and student volunteers have a good understanding of their circumstances in general. Such an approach forms bonds and friendships. The team also provides them with home-based care, for example, provision of groceries if necessary. Number six, the power of touch is immense. I spoke earlier about the release of oxytocin through touch. A soft touch, holding a patient's hand, or gently touching their shoulder, giving the patient a hug, All these build trust between the physician and the patient like no words can. Number 7, taking care of ourselves. We will be unable to practice compassion if we experience burnout and become emotionally exhausted and depersonalized. That's an extensive topic and for another day. Number 8, mentors must role model compassion in their day-to-day work with patients in order for others on the team to do the same. Let us remember that physicians and members of the healthcare team are not just providers of treatment, but also a part of the treatment. Healthcare is a calling, not just a job. Walking with people through the worst, most intimate moments of their lives is a sacred thing. It requires a level of personal interest and investment by healthcare workers. When patients' health and well-being are at stake, time, emotion, empathy, and compassion should be non-negotiable. I will close by saying that compassion can change the trajectory of a patient's life forever. The Dalai Lama said, love and compassion are necessities, not luxuries. Without them, humanity cannot survive. I appreciate very much the time you have taken to watch my video. Thank you.